Hi everyone, welcome to the Michener Institute Chiropody program. I'm very glad you're here looking at a career in chiropody. My name is Catherine Gray. I'm academic chair and discipline head of chiropody at UHN. I'm a graduate of the program and I'm here to introduce you to this wonderful profession. So a career in healthcare is something that is very essential and we cannot ignore the feet. So if you're here to look at feet for a long time to come. It is a 3-year program. We have an on-site clinic that you do clinical practice with patients and you treat patients right from first year into your final 3rd year, and upon graduation it is a regulatory profession where you can practice in private practice with other healthcare providers, in family health teams. Clinical care is essential. Might be even in a hospital setting. So lots of opportunities, lots of feet across the province and across the country. It is the only program in Canada. There is a French-only podiatry program in Quebec, but it is an essential program. And I feel strongly and really glad that you are looking into this career. There is a lower limb amputation in Ontario, 1 every 4 hours, and we do a great deal in helping to prevent that number from increase. Diabetes and systemic diseases are all parts of what you will learn, not only just about the feet. There is a dissection component with anatomy to learn about the lower limb. There's lots of hands-on skills labs. Right now we are under a COVID adjustment to our program delivery, and some of our labs and program is delivered virtually. We've adjusted just phenomenally with being able to deliver and continue this program right now with COVID being around us. So we do have our clinic where patients are being treated, but yet there's a delivery off-site virtually, as well as some compressed labs that will happen later in each semester. We want everyone to succeed upon graduation, and so that is our goal in helping you through these 3 years. The 3 years are compounding knowledge from the first day you come in to the last day you graduate until your regulatory board exam. It is something that is rewarding and fulfilling, and as you know, feet are very important. So I continue to pursue this avenue, continue to do some research, reach out and ask any questions to make sure you're making a sound decision. Thank you.
My name is Meera Narendran. I am a chiropodist and a professor at the Michener Institute. I have been with the Institute for now over 18 years. I've been teaching I teach biomechanics as well as pathophysiology, and I also teach in the clinic. In addition to being a professor, I also do the role of a program communication liaison, where I assist student issues and kind of liaise between the students as well as the chair. The program is very unique and it's an exciting program. It's a 3-year program. We relaunched this new structure back in 2006. Before that, students were able to come with their with their high school diploma, but there was a varied pool of students, and it wasn't the ideal situation for learning. So we relaunched the program with the undergraduate degree requirement as well as some course requirements as well. So we can take the program to the higher level of learning required for a healthcare practitioner. Chiropodists are primary care practitioners similar to physicians as well as dentists. So for patients to be seen by you, they do not need to be referred by a family physician or any other physician. Patients can directly come to you, and you are responsible for all the ailments that are in the feet, as well as recognizing systemic conditions as well. well. Sometimes chiropodists are the ones who are recognizing certain systemic conditions for the first time, and then we make the referral for the patient to go see the practitioner. So we have a very important, significant role in caring for the public. The program itself is 3 years long. What's good about this program is we teach didactic courses, but we also have labs associated with pretty much all the courses. And then once you learn those skills in the lab, we integrate you right into the clinical setting right from the second semester onwards. So what you learned in theory, you practice it in the lab, and then you go and apply it in the clinical setting. So it's very well integrated. And also what's good is that the teachers or the professors who taught you the didactic courses are in the clinical setting as well. So they can actually tell you, okay, you know, remember we learned about this, and now this patient has this. So you actually integrate that didactic learning into the clinical setting. Okay, and that way you build a good understanding of the pathological conditions that you have learned in the textbook and the lectures, and now you learn how to manage that patient. You are also learning a very important skill is in terms of communication and interpersonal skills with the patient. You learn how to manage patients, their emotions, their sensitivities, and you know, you could have a very easygoing patient, but you can also have a very difficult patient, and you actually learn how to manage that as well in the clinical setting. So this is our teaching clinic. This is our reception area, and our boss is sitting there, Melissa. And then we go into our clinic itself. This is the hallway, and we have 10 treatment rooms. As you can see, on either sides there are doors. And a patient is booked for each of the students who is going to be in clinic. What's unique about our program is that we integrate clinical training right from the first year, and we have our own teaching clinic on the 3rd floor of the building, and this is our clinical space. In the integration piece, you learn the didactic knowledge in class, and then you will get exposed to these skills in the lab setting, and then you will come into the clinic space to actually apply it on real life patients. So starting that kind of practice right from the beginning enhances your learning and patient care. Okay, so this is our treatment room. A typical treatment room. You would come in, patient would come in, that's the patient chair. There's a practitioner chair, and we have the electronic patient record system, which is the computer over here. And the unique thing about our treatment clinic is that we have one-way mirrors over there. So the instructors or even other students who, if there's a patient with a unique condition, the students can gather around behind the one-way mirror and observe the pathology as well as the treatment. Also clinical evaluations. When the patient is being treated, we evaluate the students, and that evaluation happens from behind the one-way mirror. That way we are not in your face, and it's not very stressful experience. But at the same time, we can ensure that you are learning the right skills along the way. This is a treatment room. The students right now are practicing on each other while they are waiting for the next patient. And that's another advantage in our program, where they can practice on each other, not necessarily on patients. So we have the 2 students doing the assessments of the foot. And here the student is checking for the circulatory status of the patient. And over here is where students will learn about the patient care skills. So in first year, you will learn about the assessment skills, how to take the pulses, how to check for the pulses in the feet, how to check the ranges of motion within the foot, how to check for neurological status, so monofilament vibration, all those kind of tests. You learn that in this space, and those skills you actually learn on each other. So one student will be a practitioner and the other student will be a patient, and you learn in real